Let's talk about something that can feel really personal, and honestly, a little overwhelming. Navigating women's health procedures, especially around sexual well-being. How do you know if you're getting advice that truly has your best interests at heart? Well, today, we're going to dive into what a real gold standard approach looks like, using the principles from the Women's Health Clinic to guide us. We're going to explore what empowered consent actually means for you.
So here's our roadmap. We'll kick things off by talking about why proven expertise is the bedrock of trust. Then we'll get into the patient side of things, before really breaking down what an empowering consultation should feel like step by step. We'll also touch on the really important ethical rules that are there to protect you, and finally, we'll see how it all comes together to put you in the driver's seat of your own health decisions.
All right, so first things first, who is the expert behind this patient-first philosophy? Well, at the Women's Health Clinic, that's Dr. Farzana Khan. Her entire approach is built on a really deep, dedicated background in medicine that's specifically focused on women's health. So let's take a quick look at the journey that shaped everything she does.
You can see from this timeline that this was a very deliberate journey. I mean, look at this. Dr. Khan's 20-year career started with a super strong foundation in core areas like dermatology and gynecology, long before she ever got into aesthetics. This is so important because it means her work today isn't just an add-on. It's a career that was built first and foremost on women's health. And these qualifications, they really anchor that experience. Beyond the medical degree, that MRCGP means she's met a benchmark of excellence in family medicine, and the diploma in sexual and reproductive health? That shows an even deeper level of specialization. So when you put it all together, you're looking at a level of expertise that goes way beyond just procedures. It's about understanding a woman's total well-being.
Okay, so we've established the expertise. Now let's switch gears and focus on the patient experience. Why do women even seek out this kind of specialized care? The reasons are often really sensitive, incredibly common, and you know what? They are always valid.
These are some of those deeply personal issues that can have a huge impact on your quality of life. I mean, things like painful intercourse, which has the clinical name dyspareunia, that is not just something you have to live with. No way. These are real medical concerns. The absolute key is creating a safe, non-judgmental space where talking about these things is the first step toward a solution, not a barrier to getting help.
And this quote just perfectly captures the philosophy needed for that safe space. See, the goal isn't just to treat one specific condition, it's about nurturing your overall wellness. This way of thinking frames these clinical issues in a much bigger, much more compassionate context of care.
And that brings us right to the heart of it all, the consultation itself. So what does a truly thorough and empowering conversation about consent actually look like? I'll tell you this much, it's way more than just a quick chat before a procedure.
This quote from the Women's Health Clinic just gets straight to the point, doesn't it? The goal is not to get you to sign a piece of paper. The real goal is to build a shared understanding through an open, ongoing conversation where you feel completely heard and 100% informed.
A gold standard consultation really follows a clear path. First, it starts with listening to you. Then it moves to setting clear and honest expectations, like what can this realistically do for you and how long is it going to take? It has to transparently cover every single risk, explore the non-procedural options first, and make sure there are zero financial surprises. Every single step is designed to build clarity and trust. This is not a sales pitch, it's a partnership.
And during that conversation, it's so important to talk about the unspoken fears. So many women worry they'll be judged. But the answer you should get from an ethical clinician is a clear, resounding no. Your sexual health, your comfort, and your confidence are absolutely valid parts of your overall health, and your concerns deserve to be taken seriously, period.
Now, this whole structured conversation, it isn't just about a doctor being nice or following good practice. It's actually backed up by some really solid ethical and legal frameworks that are designed specifically to protect you, the patient. Let's look at a couple of the key ones that make sure your safety and your choices come first.
First up is something called the cooling off period. This is a mandatory rule, okay? And its purpose is so simple but so powerful. It gives you time to go home, think about everything you heard, and process it all without any pressure to make a decision right then and there. It ensures your choice is a considered one, not a rushed one. Next is a legal principle that honestly changed everything about consent. It's called the Montgomery Standard. Before this, a doctor might just list off some general statistics about risks, but now they are legally required to ask about your life and talk about the risks that are meaningful specifically to you. Are you an avid runner, a new mom? The conversation has to be tailored to your life.
It's a huge shift from, here's what I think you should know, to what's important for you to know.
And this is how it all comes together in a clear, two-stage process. Consent isn't just a single moment in time. Stage 1 is the conversation, the dialogue, where you gather all the information. Stage 2, and this is key, only happens after you've had that cooling off period to think. That's when you confirm. The final signature happens on your timeline, which just reinforces that you are always in control.
And to support all this, clinicians use objective tools. For example, the Female Sexual Function Index, or FSFI, helps set a clinical baseline for things like desire and comfort. This helps ground expectations in measurable improvement, not some vague idea of perfection. And just as important is safety screening for things like body dysmorphic disorder, or BDD. It's a vital step to make sure our procedure is actually in a patient's best psychological interest. This is what truly responsible care looks like.
So, as we start to bring this all together, we get to the ultimate point of this entire process. You see, the main goal of a good clinician isn't to sell you a procedure. It's to empower you to make the decision that is genuinely the best one for you.
And that is exactly why a truly great consultation will always include non-procedural alternatives. Because sometimes the best solution isn't a laser or an injection at all. It might be physiotherapy, or topical treatments, or even counseling. A real commitment to your well-being means putting all the viable options on the table, not just the ones that involve a machine or a needle.
At the end of the day, this is the big takeaway. The entire framework, from the deep expertise to understanding your concerns, all the way to that detailed, two-stage consent process, it's all built to support shared decision-making. It completely transforms the doctor-patient relationship from a top-down instruction into a true collaborative partnership.
So, we'll leave you with this question to think about. After everything we've talked about, think about your own experiences with healthcare. What does feeling truly heard, totally informed, and genuinely empowered actually look like to you? Because that right there, that is the standard of care every single one of us deserves.